Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators transforming health. I'm your host, Unity Stoakes. If you spend any time in health innovation, you probably heard the phrase food as medicine. Sometimes it's called food as health or food is medicine. It may sound like a buzzword, but the idea is simple and powerful. What we eat plays a major role in preventing, managing, and even reversing many of the chronic diseases that shape our lives and our healthcare system. Food is not just fuel, it is deeply connected to the health, culture, community, and quality of life that we all lead. When we start to treat nutrition as a core part of our care, we open the door to better outcomes, lower costs, and more human-centered healthcare. It's an exciting moment for the food as medicine movement, and in this episode, we're bringing together two conversations from leaders helping shape what comes next. First, you'll hear from Richard Bennett, CEO and co-founder of Epicured, in conversation with our friend Logan Plaster about the trends he's seeing that are changing the moment for food as medicine. Then we'll turn to Victor Penev, CEO and founder of Edamam, one of our longest health transformers in startup health, for a look at how AI and food data are helping power the future of personalized nutrition. Let's dive in.
Richard Bennett, CEO and co-founder of Epicured. Thanks for joining me as always.
It's always good to be with you. Thanks for taking the time.
So we're talking a lot at Startup Health about the idea of food as medicine. It's not a new idea, but it's certainly something that we're spending a lot of time talking about. And we launched the Startup Health Food as Medicine Moonshot, which you're a part of. So I want to just start with this idea that you are really actually doing this work, where you're trying to conceptualize what it means for food to be medicine. It feels like what you've built at Epicured is at ground zero. So just break it down for us.
Absolutely. Well, it's really an exciting time for food as medicine, which means it's an exciting time in healthcare and for individuals to really get healthier again in the United States. For us at Epicured, we've been building Epicured for 9 years, so we're not new to this market. We've been working and doing our part to really enforce the importance of the role of food as medicine, registered dietitians, nutritionists, chefs, and how we can help people live healthier lives and really think more around whole person care. And if you go back to the inception of Epicured, I mean, we started talking about Epicured in 2006. We founded it finally in 2016, and we've been building the company from a local brand to now a national brand. And we actually have our first international project that we're launching too. So it will be global before you know it. But if you keep it contained to the United States and where clinical mindsets are, payer mindsets, consumer mindsets, they're all aligned on the benefit and the role of food as medicine to really tackle some of our biggest problems.
What's sort of broken about the way you see how this has been handled over the last couple decades?
Well, I mean, if you really go back to the root cause, what's been broken is ever in a post-industrialized society in the United States, you had healthcare and food, the two industries, right? Totally divorced from each other and almost working at odds. Healthcare didn't understand food and food didn't understand healthcare. Food was calibrated after the world wars around feeding the most people with the cheapest calories. And it was about avoiding famine. But the way we approach that in food actually triggered a tremendous amount of chronic disease burden in the societies that were using that methodology. And while healthcare focused on longevity of life generally and extending life expectancy and using pharmaceuticals and acute care interventions, that allowed kind of chronic disease to really become a problem. For a long time, healthcare didn't know how to handle that. We had a real fee-for-service model. Value-based care wasn't a thing. Doctors weren't trained in nutrition. So you had this context, this petri dish for a perfect storm, which is now completely changed in people's mindset. And people are making real structural changes in the industry to make it more accessible.
One of the things I find fascinating about Epicured is that you're also building on current market trends, or at least trends over the last 10 years in terms of meal prep, food delivery services. You're kind of tapping into the cultural understanding of meals being delivered, but you're doing it with this healthcare angle. Where are current attitudes right now in terms of consumers?
I think the biggest trend is across the generations and age groups, people understand more and more what you put in your body is going to change how you feel. It's going to change how you are able to live your life. And it's not just about pure enjoyment or, satisfaction with what you're eating. And it's also become a little less cool to eat the fried foods, right? And so there's been a good amount of peer pressure societally to think about, where does the food come from? What is it doing to my body? What is it doing to my children or my mother and father who I'm supporting? And there's more thought that goes into it than ever before. And therefore, people are willing to spend their time and dollars differently to get a different outcome because they've seen that the outcomes have been pretty poor. And people are beginning to correlate that the outcomes being poor tie in with the daily decisions of what you're putting into your body. And we stand on the shoulders of giants, and we've worked with clinical researchers, academics, policymakers, lobbyists who've been working on this for just as long or longer than we have. But the concept is that it needs to be covered and reimbursable. And that's what we've finally hit. For us, we signed our first reimbursable contract in December of 2023. And so we've been implementing that. And then we signed 4 Medicaid contracts that we're implementing now, focused on an elderly population in a PACE construct, which is the program for all-inclusive care of the elderly, which is often a vulnerable population and socially isolated and not cared for as well as they could. And then Medicaid broadly is designed to take care of our most vulnerable Americans.
So I'm always sort of curious, like, what is going to be the thing that builds the relationship that then allows you to have a more holistic health experience? And I hadn't really thought before about the power of food as being that foot in the door.
Your listeners and readers, I know a lot about healthcare, so it'll resonate that trust is unbelievably important in healthcare. And our ability to build trust through filling a care gap in nutrition allows us to open up a dialogue around transportation or around housing or around economic insecurity for the need of a job, right? And so all of these tie into your social determinants of health, but you can't really build the trust on housing, transportation. The best benefit to lead with is around nutrition. And so we use our 21 meals a week as 21 touch points. And then we make sure that while we're engaging them with the delivery confirmation, oh, look what you're getting next week with your meals. Oh, you met with our registered dietitian. We have a whole concierge team in our call center. And so we now have a relationship that the insurance companies or even the physicians don't have, that we can then use to say, great, that you love the food, but you're having a hard time getting to your next doctor's visit. Let me navigate you to our transportation partner. And you're beginning to really do whole person care using food, the power of food and the relationship there, to then you're cracking that nut. We've built trust with you. We built the relationship. And so we're really a relationship first company, and we use food to build that relationship.
So I'm curious, what are 1 or 2 things that from your past before Epicured that kind of feed into this work and make it possible for you and the team to accomplish something at this scale?
Well, we have a great team. First and foremost, we've been able to recruit the best and brightest from culinary to clinical to supply chain management to operations. For me, I mean, my background was in Northwell in supply chain management, revenue cycle management, hospital administration. And then I founded the venture fund and we built consumer health and wellness businesses. So I've always loved this intersection of a consumer mindset and a patient mindset. Right. And now for me, I've always been on the healthcare side, but now I get to look at the culinary side and the clinical side and how we bring them together. And we're really proud. One of our clients asked us to develop Liberian dishes so that we could help penetrate a specific population in one of these Medicaid contracts. And so we do El Salvadorian, we do Puerto Rican, we do Liberian. And I love the concept of food as medicine, but I like to underscore that food is not a pill. It's social, emotional, cultural. And it's a pretty dystopian world where we're all sitting down to eat our pills together. Like, that's not the future.
Yeah.
So we need to like really harness the power of that. And we bring that to life in a really cool way.
That was Richard Bennett of Epicured with Logan Plaster. Next, I'm joined by longtime health transformer Victor Penev, CEO and founder of Edamam. Victor has been a pioneer in food data and a leader in the food as medicine movement for many years, well before the space had the momentum it has today. I'm excited for this conversation. We talk about what's changing in the market, why this moment matters, and how AI is making personalized nutrition more practical, more scalable, and more powerful than ever. Here's my conversation with Victor Penev. Victor, how are you?
Quite good. Quite good.
You have so much momentum. You've got a lot of news to share. And why don't we start with you reminding everyone what Edamam's vision is and what Edamam is doing for the world?
All right. I love that question. So the vision is, well, the mission is to organize the world's food knowledge so we can help everyone make the right food choices and eventually live long, healthy lives. It is driven by that belief that people can live up to 120 years without chronic conditions, without mental illness. Prevention is the name of the game, and that food is an instrumental part of that lifestyle change that people can do to live to 120 years healthy. And so we ended up focusing on organizing the world's food knowledge so we can make this happen, actually help people in everyday decisions to choose the food that's right for them, that they like, and that will help them live long, healthy lives. So that's the mission and the vision. Eventually, we want to help everyone in the world eat the best way they can.
You have been a longtime health transformer. You're an OG startup health in our community and ecosystem. This is not a new mission for you. You have been on this journey for some years now and have just been a really early innovator and really at the forefront of now what's known as the food as medicine ecosystem. And we have a food as medicine moonshot. I think back when we first met you, there was only a handful of companies and people even focusing on this area. Bring us to the present day. What are you seeing? What's changed in the category that you're in? What are you noticing?
Oh, lots has changed. I mean, as you said, when we started, we were very few of the technology companies that were talking about food as medicine and whatnot. There were obviously influencers and people talking about it. Companies that wanted to solve the solution with technology, there were not that many. So what's happening is a lot of mega trends that are converging to a moment where the thing is going to become reality. First and foremost, I think it's AI, because it is allowing true personalization in an intuitive manner. And this is something we are focused on, building on top of our data. We have a very unique data set, probably the largest data set of food and nutrition in the world, very accurate, something that we can leverage. And with AI, we can drive that through personalization. So the emergence of generative AI is an important trend that is driving that process. The second is, as you mentioned, food as medicine has become a thing, right? Now people talk about it, people try to build around it, and there is actual business model, Medicare, Medicaid, reimbursing for medically tailored meals, medically tailored groceries. And once there is a business model, people flock into it. So there is a momentum around there's a cottage industry of companies that are working on food as medicine. And that is very important because once money is in the pot, then it's a lot easier to create business models. And related to that is the consumer awareness, right? People are a lot more aware now about the impact of food on their health and well-being. Part of it was driven, unfortunately, through the COVID pandemic and the fact people realized that lifestyle is an important factor when you get infected. Part of it is the whole conversation around longevity and wearables and ways to measure with CGM and all that stuff. So all of that is essentially bringing up consumer awareness. So people want to know what they're eating and how it impacts their health. And then last but not least, it's a little bit out of left field, but it's GLP-1. So GLP-1 is what I call a gateway drug for us, because GLP-1 requires companion diets. And this is something that we excel with, recommend what people should eat, meal planning, meal recommendations, leveraging a lot of data, detailed data. And this is what we're doing. And once GLP-1 breaks through, that is true for all the other chronic conditions, whether you have diabetes, Alzheimer's, kidney disease, etc. Diet is important, but the adoption of diet alongside chronic condition management was more kind of people were paying lip service. With GLP-1, they're actually doing it because people are saying, look, I need to maintain muscle mass, not to waste away. And so food becomes an important element of the treatment. And we think that GLP-1 is going to change the way people think about food alongside chronic condition management. So those are the four trends.
Those are major trends and they're all converging. And what's so interesting is you were very prescient in that you were building and organizing this food data base that years before, and now it's becoming so useful and so relevant. In fact, you had announced some news recently about how you're using AI as part of a meal planner agent. Can you talk a little bit about what you announced and how that works?
Yeah, absolutely. Just as a background, AI, as I mentioned, helps with personalization. It also helps with intuitive interaction for people. So it has the potential of driving behavior change, which is really key. But for the AI to be effective, it has to leverage data. And this is where we come in. We leverage our data, our brand, our customer base. And what we are building, what the long-term vision is something that Edamam has always wanted to build, is personal virtual nutritionist. Something in the cloud that knows you very well, is available 24/7, knows contextually what you like, what you dislike, what your price point is, what allergens and diets you have, what medication you're taking, and can contextually help you eat, recommend meals, remind you to shop for this item, not that item, realize that you're in a restaurant and recommend a meal from there. So this is the long-term vision. Now, what we're starting with is a much more granular approach with an AI meal planning agent. So this is an AI-based agent that allows personally to have a conversation with you, really understand who you are like a dietitian, and then be able to recommend a meal plan. And after this first agent, we'll be building other agents like food logging agent and nudging agent, etc. And we'll orchestrate them and help them work all together. So essentially, we'll build a virtual nutritionist that is personalized to you and is there for you at 2 o'clock in the morning. If you say, oh, I just ate this big pizza and I shouldn't have, but what can I do? And it will gently push you in the right direction and suggest things to do the next day. So this is what we're building. The AI meal planning agent is something that we've launched recently for beta testing. We're also leveraging AI in other ways. We are doing automated food logging with images, so you can take a photo. Now, AI allows very good recognition of the image, and then it calls our nutrition analysis or API, so we can produce all the nutrition data. We've also used AI to create a data set of recipes that represent the most commonly eaten meals around the world, which is a useful data set. So we are leveraging AI in lots of different ways to improve our data and provide better experiences for our customers.
How do you think about the moment we're in, the new, let's call it the post-GPT world of AI? And what would your advice be to other innovators out there that are maybe haven't gotten the memo yet?
Yeah, I would provide a nuanced answer to that. So AI, without any hesitation, is going to change how the world works. So people are just interacting differently with technology. And it feels actually not as much as the mobile revolution, but more like the advent of the internet.
Yeah.
It is a different way to interact with technology. So you should definitely do something about AI. Now, what you do really depends on who you are, what your business model, and that's where the nuance in my answer comes in, because AI is ultimately just a tool, super powerful tool. I think for us, it made our vision, a 50-year vision, a reality now. We always thought we're going to build a personal virtual nutritionist, but we didn't have the tools to do it. Now we can do it. But that doesn't mean you have to apply AI across the board. It still has problems, quite a few. And there's obviously the utopian future. AI is going to take over everything and it's going to solve all the medical problems. and nuclear fusion and all that stuff. It's great. And there's also dystopian future. It's going to take away all the jobs and robots are going to kill everyone. I think the truth is neither one of those. It's somewhere in the middle, but you need to really evaluate what your core value proposition is. And for us, it's actually data, right? So we're not moving away from that. We are a data company. We started building data set, organizing the world's food knowledge, it's data, and we focus on data. AI is just a better way to present this data. And not every business problem has as a solution AI. Sometimes you just need to use humans, or you need to use traditional machine learning as opposed to generative AI. You find out what the problems are and then go for it. I think very realistic view of what AI can do. So you need to educate yourself, you need to educate a team, and be realistic of what it can do and when it's best to apply it versus not apply it. And then go and actually do it. If you just say, oh, I'm going to wait, you're probably going to get swept away. Everybody else is adopting it, and they will create better interfaces, better usage and whatnot. So you don't have the luxury to wait. On the other hand, don't go head first into that, because most likely you're going to end up with technology that doesn't work as expected just because it's so hyped out. So it is a balancing act. You get to find like the middle point.
It's such a wild time to be looking at these intersecting trends, and within the context of food as medicine even being a thing, right? This must be satisfying to you, because you were one of the early people, innovators, focusing on this, trying to get other people to even listen to this as a concept. How do you feel about where the market is and the advancement of the category?
Yeah, look, I'm a long-term optimist. I think those mega trends are going to continue, and long-term, we will have really good solutions for how people to eat better. And we hope to be part of those solutions and power with our data, many of them. Short-term, things will be very turbulent. And I wouldn't be honest if I say I'm 100% optimist. There's a lot of things that can go wrong. AI may disappoint in the way it actually presents. So it may become actually expensive, with reasoning models becoming more expensive with tokens and stuff like that. There might be some pushback in terms of the business model of Medicare and Medicaid reimbursing. If they get budgets cut, et cetera, who's going to step in? I think that will eventually get resolved, but the market might be in a bubble. And if it slumps significantly, well, some budget's going to get cut, and that will impact business. So there's a lot of things that will be turbulent in the short term, and I hope for the best. I'm always an optimist. I can't be an entrepreneur without being an optimist, right? You always have to have a little bit of the rose glasses on and believe that things are going to happen.
It's the only way to get through the day, right? I mean,
right. But I'm also a realist. I understand that there are a lot of threats, and then you should have, I guess, a strategy of implementation that allows you to have a fallback. If something goes wrong, what's the fallback? For us, the fallback is data. In that database that we've built, even if all of it fails, we still have that data on which to step on. So the short-term ambivalent, because of all those things that are happening, it's an insecure world. But long-term, I think the trends are unmistakable. Food is medicine, consumer awareness, the way to treat and prevent disease, AI becoming, I think all those are going to survive. And I think in 5 to 10 years, we'll live in a completely different world.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.